Hi, I'm Dr. Fred Wilder. I am a board-certified plastic surgeon. So one of the common things that we see today, in part because of the catchy name, is when people come in asking for a mommy makeover. Mommy makeover is not a given procedure. A mommy makeover is sort of a combination or a constitution of procedures done to deal with, guess what, the consequences of being a mommy. So the things that we typically look at when somebody comes in to discuss mommy makeover are the breasts, because they can oftentimes change dramatically with pregnancy and breastfeeding. The tummy, obviously, because of the baby inside, and the bigger the baby, and twins obviously have more of an impact than smaller babies. And then lastly, it oftentimes involves different degrees of body contouring with such things as liposuction, because many women gain quite a bit of weight during their pregnancy, and once they lose that weight, there may be distributions of fat and looseness in other parts of the body. So the mommy makeover is completely varied from person to person. In general, the best time is when a mommy is through having babies, because you don't want to go through a big, involved, expensive operation and wind up possibly having to do it again. Would be good for me, but not necessarily good for the mommy. So certain things can be done in between babies. An example of this would be breast implants. If somebody loses volume with a pregnancy but doesn't have any significant droopiness that might require a breast lift, then we can certainly put in breast implants, understanding that we may have to redo something after subsequent babies, but that's something that can safely be done. Similarly, we can do liposuction of different areas following a baby and in anticipation of babies in the future. The one thing I don't recommend doing is doing such a thing as a full tummy tuck, which involves tightening of both the muscles and the skin of the abdomen. There's no point in going through that big involved operation only to possibly have to do it again following a subsequent baby. The important thing is that you need to make sure that your baby weight is gone. There's no better candidate for any type of body contouring than somebody who is at their ideal body weight, or at least a stable body weight that they intend to maintain. So you have to get your body back to where you think it's going to be. You have to be several months removed from breastfeeding, because breast surgery can stimulate the breast to lactate again. So the timing is important. You can't do it immediately after you've finished having a baby, or immediately after you've finished breastfeeding. The other thing you've got to keep in mind is that you've got a small baby at home that you have to take care of. And one of the restrictions when we do tummies and breasts is that you have to avoid heavy lifting. So the timing of these procedures is something that's quite important.